I'm Dr. Alberts. I'm speaking from Germany. I'm an endocrinologist in Germany. I'm gonna answer your questions. There came a question from a patient about the following situation. I should take levothyroxine hormones in the morning. That's what my doctor said. But is it right? Should I take it at any other time during the day? So I told this patient there is no problem in taking levothyroxine in other times of the day. That's not a problem. Usually, we suggest patients to take it in the early morning because we have an empty stomach. And levothyroxine is better absorbed through the body when the stomach is empty. When you have eaten something, then the absorption of the hormone is not so good. That's the problem, and that's the question, and that's the reason why the most colleagues and most doctors suggest that levothyroxine should be taken in the morning. But there are studies. For example, there's a study from Netherlands. It was made in 2010, and it compared patients who took levothyroxine in the morning or alternative in the afternoon or in the evening. The most important was it that patients didn't eat anything after 2 hours, and thereafter they took the hormone, the levothyroxine. And these patients, compared to patients who took levothyroxine in the morning, they had no problem and no difference in the levels of thyroid hormones in the blood. Why does it happen? Because thyroid hormones, they stay on the body. They stay for 7 days in our body. For this reason, when they stay in the body, it makes no difference. For example, if you take it early in the morning or in the afternoon, they are working for 24 hours and even for 7 days. That's the same reason why patients who need to make a blood control of levothyroxine levels, they don't need to make it to not to take the medication before the exam. It makes no difference if they take the vitamin on the day of the exam or if they do not take this vitamin. It's different with other medications, but thyroid medications, you don't have to make a pause for the day of the exam. You can take it on that day because it's what we call a depot vitamin. It stays in the body for many days. For this reason, if your doctor asks you, of course, we have to make an exam, we have to control the levothyroxine levels in the blood, and then you can be sure that you don't have to make a pause on the treatment of levothyroxine. You can take the medication on that day and you make the blood control. There's no need to make like 1 or 2 days before the controls that you take, or take a double medication so to assure that it works. It makes no difference. After all, the results will reflect what's happening in the body for the last 7 days. And in the case of TSH, which is also a blood level to be controlled, the TSH, it takes a long time for the TSH to adapt to our body dynamic. So many times TSH levels are like reflecting the last month or last 45 days, and they do not reflect the current reality of the patient. For these reasons, we work the most times with having the free T4 as our goal for the treatment. That means TSH, it's not always our goal for the treatment. On most times, we specialists, endocrinologists, we work with free T4 as our goal for the treatment. If you have any questions, you can write down here at the comments. I'll be more than glad to answer your questions. I hope you have a nice day and a nice week. Wish you all the best. See you next time. Bye bye.